Welcome to the Tools of the Trade. For those of you who don't know, my name's Rebecca Jackson. I'm the director for the Center for Clinical and Translational Science. And one of the goals of the CCTS is to really create the infrastructure and to support the education and career development that take basic science discoveries that go on every day at the laboratories here and across the United States and the world, and actually to translate that information to things that have a impact on human health. And really nowhere is that more important than when we take those new ideas and we bring them to the bedside and then later bring them into the community for adoption. And as many of you know, I think as scientists, we're very good about thinking about the nuances to how we develop our studies and move science forward, sometimes where the challenge is in the implementation, that we don't think about the feasibility of the study, we don't think about how it may relate to, in fact, the important goals of our participants, where we can actually understand what that means, and of course, think about the burden of these studies and how that can affect their long-term retention. And so the session for today really is focused on that. It's focused on maybe one of the most important parts in translational science, which is our partners in clinical and translational research, which are the participants who are actually affected by the diseases that we study or the ways of improving health that we're looking at, who in fact, in every way of thinking about it, are truly our partners in terms of moving these things forward. And so what we hope you'll do after our sitting together with us for the next 4.5 hours is, I think, to think about recruitment and retention in a totally different ways. And what we hope you're going to walk away with is kind of a toolkit of different approaches and different ways that you can more effectively do your jobs or design your studies or move things forward in a way that we get those critically important answers that are necessary for us to really, I think, realize the promise of all the things that we do on a daily basis. So I thank all of you for attending. Certainly here at the CCTS, we're here to support you. And so you're going to find out from a number of people about resources that are here. We hope that you'll come to us. We're here no matter what area you work in. We're pretty agnostic, so we're really here to support your success. So I'm going to turn this over now, I think, to Stuart, who goes through with things. But enjoy your afternoon. I'm going to go spend the time, believe it or not, on a budget call. So hopefully I'll come back up after, but I'm going to deal with that other unpleasant part, which is dealing with money. So thanks.
Well, thanks, Becky. And again, I would like to extend Becky's welcome to you all for coming today. I'm Stuart Hobbs, the Manager of Research, Education, and Training Programs for the CCTS. And I think we've organized, I hope will be a very enlightening program for you, and don't want to take any more time to get started. So the first part of the program, talking about the ethical framework for research participation, will feature Michael Pera, who is a professor of internal medicine and with a research interest in HIV and viral infections, and he serves as the Director of Regulatory Knowledge and Ethics Programs for the CCTS. And also Carson Reeder, who is Regulatory Manager and Research Ethics Officer for the CCTS, and he provides services to researchers for ethics protocol development, IRB submission, and safety monitoring. So without any further ado, I'll give you Dr. Pera and Dr. Reeder.